Hi, I'm Claudia St. I'm the president of the Affinity HR Group. We are your HR partner and resource. So, COVID is sort of like it's like living in a time warp, hyper speed that's also in molasses. So yesterday, almost all of the calls, literally yesterday, almost all of the calls were related to infections at work, employees that are out sick, an employee's husband has COVID, clients of mine that are out sick. So very, very much still a very active situation having COVID out there. But today, all of the calls have been about how do we reopen? How do we open up our business? And how do we get folks back to the office? So I'd like to have that be the topic for today, how to reopen. Very exciting that that's a possibility. That said, the virus is still right out there. It's the decision to reopen is really not the suggestion that the virus is no longer active and a threat. It's that economic needs require us to go to work despite that threat. So that really is the context with which you should be looking at returning to work. So what we recommend are a number of things. First of all, those who can still work from home should continue to work from home. That is still the safest option for providing and allowing for social distancing. So if they can do their work at home, continue to allow them to do that. That is still, again, what is recommended. Those who you're bringing back to the office, the priority needs to continue to be on social distancing. So make sure that none of the workstations are any closer than at least 6 feet apart. If you have desks that don't have partitions, see if you can get partitions put in between desks in order to create a barrier between your employees for things such as respiratory coughs and sneezes, to create some sort of a physical barrier between your employees. Stagger work times. Consider having some of your employees come in the morning and some employees come in the afternoon so that you don't have everybody in at the same time on top of each other. And again, those who can work from home, if they can't work from home full-time, maybe you can have them work in the office in the morning and at home in the afternoon. So being creative around that. Looking at your entire physical space as an opportunity to create workspaces. So for example, if you have a large utility closet, you can throw an office in there, put somebody in there. Again, this is rubber bands and bubble gum. We're just trying to get through this moment in time. So if you can be creative about where you put employees, that's great. Make sure you have sufficient PPE, personal protective equipment, such as face masks and gloves. If they are working with you in your workplace, you can assume they are the same as being out in public. So wearing face masks at all time when at work is a good idea. It's a safe idea, and it will signal to your employees that you take their health seriously. So continuing to do that. Make sure that you have sufficient sanitation materials. So Clorox wipes, disinfectants, everything you need for employees to keep their workplace clean and keep all communal areas clean. Many employees may have some of these products at home. If they want to bring them into work to clean their own work areas, that's great. You also want to make sure that all of your communal areas, if you have a bathroom door that has knobs, that you have sanitation gel or wipes or something for folks going into the bathroom and leaving the bathroom, along with all of the notifications on how to wash your hands and reminders for folks to wash their hands and how to cover their sneezes. Make sure all of your employees are fully read up on the most recent CDC guidelines on what the ailments are with COVID, and they're changing. Now we're seeing things such as having intestinal distress, upset stomach and diarrhea, loss of smell and taste. These are all symptoms now of COVID that we didn't have just 3 weeks ago. So track the CDC guidelines, Google CDC employer resource, and see what they are saying are symptoms of COVID, and make sure every single one of your employees knows what those symptoms are, and if they have any of them, either send them home or keep them from coming to work while they are sick. The other thing is make sure you shut down your kitchen. So Disconnect the coffee pot, shut down your refrigerator, do not keep any shared food. If you have a water fountain, either see about putting in place a hands-free water fountain or put bottled water available for employees. You want to shut down all of the communal areas where possible. Finally, we've gotten a lot of questions from employers who are worried that their employees who have been out or at home may not want to come to work. So if they would rather stay home and work or stay home on unemployment than come to work. Given the expanded unemployment benefits, that's a very real consideration. Unemployment insurance is a state-by-state program, so there is no rule for what will happen to that employee. However, if that employee has gainful opportunity to work, they have a paying job available to them and are simply choosing not to take it, that is the effect of having quit. And most states do not allow you to collect unemployment benefits when a work availability exists for you. So I would caution your employees before they make that choice to know that they may be home without a job and without any unemployment benefits. So make sure you communicate that with their employees. Now again, you can't guarantee what benefits are available on unemployment because that's a state program and you have no say over whether they will get benefits or not. But most states, given the financial pressures they're facing with the volume of employees, ex-employees who don't have work alternatives, those are going to be the folks that get the priority, not your employees who have jobs available to them, but who simply don't want to work in light of coronavirus. So again, we recommend that if you can keep folks home and you do that. Finally, the last thing I will recommend is to have a professional cleaning service come in and clean your workplace before you bring employees back to work. Doing so will do two things. It will reassure your employees that you care about the workplace and that you're trying to keep them safe. And it will also establish a relationship with a company to be able to remediate your workplace should you get an infection, because although you're coming back to work, COVID is still out and about, and you need to prepare for what happens if you get an infection. So these are all some tips for you. We've produced a new COVID HR support hour. This is a prepaid hour of HR support. What we've learned about COVID is that you get one case and it is unlike every other case. If you get two cases, there's nothing similar between them. And one case requires a lot of questions, from when they go out to what to do with the workplace to how to bring them back and everything else in between. So check out our website at www.affinityhrgroup.com and look for our COVID HR support. In the meantime, I hope that you all are productive. I hope that you all are healthy, and I hope that you have a safe and healthy work week. Take care.